name is Tom Perez. I'm a student right now. I already did a patient history. I also performed the vitals, blood pressure, everything was within normal limits. I'm also going to have permission to perform this exam today. I'm also wash my hands and then I sanitize my hands. I will continue. First start with the examination of the head. I will be palpating for any masses, any tumors, anything abnormal, skin temperature as well, for any abrasions. Everything's within normal limits. While I'm in this area, I want to appreciate the eyebrows for any discoloration, any missing eyebrows would be indicative of maybe mixed edema. From here, I'm going to go ahead and come back to the ear. I examine bilaterally. I pull up and backwards on the ear. I look in. Everything's within normal limits. I would do this bilaterally. Also, while I'm here, I'm going to go ahead and palpate the occipital, the posterior, the submandibular, and also the neck region for the lymph nodes. They're within normal limits. I would do this bilaterally. Skin temperatures within normal limits. Go ahead and look up. While she's looking up, I will also examine the nose for any polyps, any growths, the consistency of the mucuses in the areas. While I'm in this area, I'm also going to check the potential reflex laterally within normal limits. While I'm here also, I can do an eye exam with a ophthalmic scope. I'm going to go in, look at this corner. I'm checking for red light reflex. I'm going to do this bilaterally. Okay. Also, I'm going to do the field gaze review. Follow my ophthalmic scope. Down here, good. Up here, good. Down here, good. Down here, lateral rectus, and then accommodation. That was superior oblique, lateral rectus, medial rectus, and accommodation as well was performed. Once I performed that, I already did my eyes, I did my ear examination. I'm going to go ahead and examine the nose, which I did, and there's no flaring going on, would be indicative of maybe some sort of breathing disorder as well, or obstruction. I'm going to check the throat. I already examined the lymph nodes, as I mentioned earlier. I'm checking for symmetry. It is midline. There's no masses, tumors going on at this time. I'm going to go ahead and have her swallow. Good. Thyroid's within normal limit, no goiter, no pulsations out of the ordinary going on. While I'm in this area, I check the symmetry bilateral on both shoulders. Go ahead and raise up, resist, good. Put your hands forward, pull, good. Push forward, good. Relax. Put your arms down. While I'm in this area, I'm going to go ahead and check the pulses. I'm going to check the brachial, good. I'm going to check the radial, good. While I'm in this area, I want to check for any abrasions, skin temperature, and everything's within normal limits. I'm going to check for capillary refill, blanch, and then release. I do this bilaterally. While I'm in this area, I can check reflexes as well. I'm going to check C5, 6, and also T1. Good. I'm also going to check triceps. Good. I'm also going to check this area right here. Peripherally balanced. Good. Put your hands like this. Any pain? No. Any pain here? Checking for carpal tunnel. I'm also performing Tinel's. I do this bilaterally. Everything's within normal limits there. I'm also going to check another method of checking refill. Bring your hand down. Release. I'm checking the radial area. Bring it down. Release. The ulnar area. Everything's within normal limits. Relax. Thank you. On this area, I'm going to go posteriorly. I want to go ahead and auscultate. I'm using the diaphragm portion. Breathe in and out. 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 Good. All right, that was within normal limits. While I'm here, I'm going to check. Go ahead and turn around this way real quick. I'm going to check the lung field as well, a little bit more this way. Good. 99?
99, 99, 99, 99.
Good. On this area, I can also percuss. Good. All right, go ahead and turn around. I'm also going to check for chest expansion. I want to push in, get some skin. Breathe in and out. Symmetry's perfect. Go ahead and breathe out again. good. Bilateral is good. Chest expansion. Also, if I want to be more accurate, I will use the tape measures to further document. Okay, while I'm here, let's go ahead and have you go face down. Relax. Good. Let's come back up right quick. Turn around. This way. Good. I'm also going to go ahead and check the area. I'm going to use the bell, but you can use the diaphragm first. I'm going to be checking for booze. Breathe in. Out. Good. All right, let's go ahead and go face down. All right. While she's in this position, I'm also observing the way she is sitting. I'm also going to have her knees flexed for better examination in the abdominal region. At this time, I'm going to go ahead and observe the area. This would be this row. No lesions, no masses, no massive pulsations out of the ordinary at this time. So therefore, what I would do is I would auscultate now. I would do it in a circular motion from left to right. I would be listening for any hyperactive bowel sounds, hypogravity. Okay. Now I'm going to palpate. No masses, no fecal impaction going on. Skin is well, temperature within normal limits. Now I'm going to percuss for dullness, different areas. Seems within normal limits. By having this position, I'm also going to check for the spleen on the left side. I'm going to lift her up, breathe out. Good. While I have her in this position, go ahead and breathe in, expire. I'm going to bring my tips of my fingertips, feel the base of the liver. Good. While I have her in this position, I'm also going to see if I can palpate the kidneys bilaterally. Good. All right. While I have her in this position, I'm also going to feel the pulsations of the popliteal. Good. I would do this bilaterally. So I come down, I'm going to check capillary refill on the distal portion of all the toes within normal limits. While I'm here, I'm going to check the dorsal pedis within normal limits. The tibial pulse, good. I would do this bilaterally as well. While I'm here, I'm going to check leg strength. Go ahead, push up, good. Bounce, good. Push down, push up, good. I would do this bilaterally as well. While she's here, I'm checking the symmetry or asymmetry on the pelvis. It looks within normal limits. Femoral, no massive pulsations within normal limits. What's it? Right there. Also, while I have it here, I would go ahead and check the kidneys. Good. That's within normal limits. One more time, chest expansion. Bring it in. Bring it out. Good. Breathe in. Good. All right. Draw them out. Thank you. I already checked the deep tendon reflexes in this area. I would check the deep tendon reflexes on the lower extremity. Let me check that here. Good. And the Achilles reflex within normal limits. While I have her in this position, I will check all the areas for anything that's very obvious. And I would also check blood pressure. Perform. Here's the first portion. Blood pressure is approximately 106 over 72, which is within normal limits. And at this time, if there's any area of complaint, which is a rib pain right now, I would also percuss that area with a tuning incorporating fracture, send out for x-rays, and refer out when necessary. All right, now for ranges of motion. Okay, turn to the right, turn to the left, move your head down, move your head back up, good. Turn your head, your circumductions within normal limits. Okay, close your eyes, put your hands out, touch this hand there, your other hand there. Posterior columns are within normal limits. No lateralization. Okay, go ahead and turn around. Touch your toes a little bit. Good. I'm checking the spine for alignment. It's within normal limit. No kyphosis or lordosis or any masses. Appreciation there. Go ahead and turn around. Good. Sit down. And also, while she's in this position, go ahead and lift your right leg, your other leg. Good. And ranges of motion are within normal limits. I performed Romberg's, and it was negative. And at this time, this concludes my examination. And there were some glitches. That's why we had to paste it. Thank you.